Knee pain can come and go, making your life extremely difficult. So that's why today we're going to talk about 5 different ways that you can control your knee pain, bulletproof your knees for the future, and set yourself up for success if you are currently dealing with knee pain. So the first technique that I'm going to show you is called a patellar mobilization. So for this, all you're going to do is straighten your leg, but relax. So your heel's going to be touching the floor, you're not contracting your thigh, and you're just hanging out here. You're going to take 2 fingers on each side and gently move the kneecap side to side. If your knee is extremely inflamed, if it's bothered, if you're having trouble walking, doing the activities you usually do, it's very important early on that we provide input to the area that's non-painful. Sometimes you'll hear it called like a non-painful stimulus. So again, we're just moving back and forth. And this shouldn't cause any discomfort. And then you can also move up and down. You take one of your hands and kind of cup the top of the patella, top of the kneecap, and then you're sliding up and down here. And just play around with what's comfortable, what feels good. Biggest thing is that, again, we're getting that input to the knee, we're getting things moving. The second technique here is also for pain management. So the next piece we're going to talk about is isometrics. So a good example of an isometric here is the wall squat. So I'm holding one position, I'm not moving at all, but I am contracting these muscles. So the great part about isometrics is that they activate the muscles, they provide endorphins to the area, which are the kind of those feel-good chemicals, and they don't stress the knee too much. So this is a great progression. After you've provided that non-painful stimulus to the area, that we start to work on some of that strengthening of those muscles, activating the muscles, but again, in a situation where this shouldn't be particularly painful. And the really cool thing about isometrics is if you perform something like a wall squat or Spanish squat with a band behind your knees, I'll maybe make another video what that looks like. You can actually reduce the amount of pain in your knees for up to 45 minutes to 2 hours. So again, that's performing wall squat, Spanish squat for 45 seconds with a 2 to 3 minute rest break between. Do that for 3 rounds. The next exercise here is called the long arc quad or seated knee extension. So what you're gonna do is sit on a box or sit in a chair where you can have some good support behind your knee. And then all you're gonna do is kick straight out and then hold that position. A lot of people make the mistake where they're kicking back and forth too quickly. So what I want you to do is kick and then you're gonna hold for 3 to 5 seconds. And the reason that this exercise is helpful, the reason that this exercise is important is because it focuses a lot on the quad muscle. So this quad muscle on top, I talk about it like an insurance policy for the knee. If the quad muscle is strong, it can make up for a lot of irritation to the area. It can make up for ligament damage because it provides a lot of stability to the knee. But if the quad muscle is weak, then it's a situation where some of those irritations, some of those tissue damages become a lot more apparent. So the stronger we get the quad, the better you're gonna feel overall. And this is a great way to start to work on quad strengthening that maybe doesn't put quite as much stress through the area as standing, if standing is particularly irritating right now. Number 4 is called the straight leg raise with box. You've likely seen a straight leg raise before where you're just raising the leg up, holding, and then bringing the leg back down. With the straight leg raise box, very similar starting position, except you're gonna bring the leg out to the side, hold, down, and then back in, making a box. And you can hold each position for maybe 2 to 3 seconds. As you can see, my leg's already shaking. But the great part about this exercise, it works not only on that quad muscle, it's also working on some of the hip muscles as you bring your leg out, as you bring your leg back in. And the hips are super important, again, for stability of the knee. So this will challenge the different heads of your quad, and we'll work on your hips and can provide pretty good challenge overall in terms of working on your knee strength, your hip stability, all that good stuff. Exercise number 5 here is the rear foot elevated split squat. So you're gonna have one foot elevated with your heel up. The other leg's gonna be straight out. And then all you're doing is bending down and then standing back up. And so this again is working on the quad muscles, but it's doing so in the standing position, and it's also increasing the amount of what we call time under tension on the quad. So it's great to work on exercises in the seated position. It's great to work on exercises where we're on the floor, but eventually we need to get you back to a position where you're doing a lot in standing. That's where life happens for the most part. So doing an exercise like this can be a great transition to quad strengthening in the standing position. With all these exercises for the knee, it's very important that we follow this spectrum, that we follow this continuum, where we're starting by reducing symptoms however we can, gradually working on strengthening the quad muscles, getting things stronger in the seated position, then transitioning to standing, and eventually getting you back to doing all the things that you want to do, all the things that are important to you, and all the things that give your life meaning. So give these exercises a try, follow the progression, symptom management, loading the quad, getting back to activity. Let me know if you have any questions at all in the comments. I'm more than happy to answer.